but that's a different class, so don't look at it now. Okay, so let's go ahead and get started. We're going to talk about the nervous system first, my favorite system. Okay, nervous system. Objectives, we always the same at the beginning of every chapter. Okay, introduction to the nervous system. Most of you probably know this, but if you don't, the nervous system is made of the central nervous system and the peripheral nervous system. So everything that we're seeing here is part of the central nervous system. And all that includes is the whole brain and all of the spinal cord, the whole spinal cord. And all of and you can see, maybe if you can see in little bitty letters, there's coverings. There's a 3-layer covering of the brain and spinal cord called the meninges. Those are also included as part of the central nervous system. But all of the nerves that come off the spinal cord, such as these that you can see coming off of the spinal cord and going through the body, those are known as the peripheral nervous system. So those are going out, think up to the periphery of the body. So they leave the spinal cord, and as soon as the nerves come out of the spinal cord, those nerves are part of the peripheral nervous system. And everything that leaves the spinal cord and the brain and goes out to the body, to the limbs, and to the feet, to the toes, to the fingers, all the way to like our face, our lips, our tongue, all that's peripheral. Okay, all that's coming off of the spinal cord and the brain. So it's peripheral. Okay, functions of the nervous system, pretty self-explanatory. Control and integrates all body functions. Communication, yes. Mental activity, thought, and memory. And I mean, besides that, where it says control and integration of all bodily functions, yes, the nervous system controls all our bodily organs, but this says control of bodily functions, but I wish they would have put some more bullets on here, because what about movement, control of balance, control of coordination, control of voluntary movements, as opposed to sometimes when you have a pathology, you have involuntary movements, things like that. Okay, so let's start talking about some word roots. And some of these you're going to recognize from other chapters, and they're going to be, if not the same, but similar to other chapters. So cephal means head. Cephal means head. Cerebe means cerebrum or brain. You can think of cerebral hemisphere if that helps you. That always means brain. But when you say cerebrum, that means you're talking about the part of the brain or the whole brain. Don't get that confused with the cerebellum, which is a separate lobe of the brain. So the cerebellum is a lobe of the brain, but when we say cerebrum, we mean the whole brain. Encephal also means brain. So cephal means head, encephal means brain. So just think it's inside, in the cephal, in the head, brain. And if you've ever heard of encephalitis, that's inflammation of the brain. Meninge, like I just said a minute ago, those are the meninges. Those are the coverings, the 3-layer covering of the brain and spinal cord. You know this, mile sometimes means myelin, like the myelin sheath around nerves, but it also can mean spinal cord. So mile can mean myelin or spinal cord. Fas, this means speech or face. If you've ever heard of somebody having aphasia, that means they can't speak after a stroke, or they have trouble speaking. Okay, this is pronounced plege or plege. This means paralysis. If you think of hemiplegia, paraplegia, those mean those are different kinds of paralysis, and we'll go over those different kinds in just a minute. Poly or poly means gray or gray matter. And psych means mind. Think of psychologist, psychiatrist means mind. And quadra means 4. Most people know quad means 4. Okay, a few prefixes and then we'll make some words. Hemi means half. So if you hear somebody say hemiplegia, that means that one half of their body is paralyzed, not from top to bottom, but from right to left. So if you have a stroke on the right side of your brain, then the left side of your body will have weakness and hemiplegia. So the arm and the leg on that side. Poly means many or much. So poly with a Y is the same with poly with an I. It means many. Okay, I said this a minute ago, aphasia. So we know A means without or difficult, and phasia is speech. So this is difficulty speaking or not speaking. And this is something that often happens after a stroke. Cephalalgia. What does cephalalgia mean? So cephal is head. Anybody remember what algia is?
Pain.
Pain.
Yes, pain. So this is head, pain in the head, or you could say this. I don't know if they would call a regular headache cephalgia, but I guess technically that is cephalgia. It is pain in the head. Cephalic just means pertaining to the head. Cerebral is just pertaining to the cerebrum, to the brain, pertaining to the brain. Cerebral thrombosis. What's this, somebody?
Blood clot.
It's a blood clot that formed in the brain. Remember, a thrombus form is a blood clot that forms somewhere, and an embolus is a blood clot that breaks off and travels somewhere. So a cerebral thrombus is a blood clot that forms in the brain. No bueno. You don't want that. Dysphagia. Dys means difficult. So this means difficulty speaking. Also after a stroke or a brain injury, you can have dysphagia, your speech can be slurred, or you can have trouble finding words. Maybe you know in your head, you know what you want to say, like there's nothing wrong with your cognition, you know what the words you want to get out, but you can't there's a disconnect between your brain and your mouth, and you can't form the speech. So you know what you want to say, you just can't get it out. Encephalitis. I said this earlier. So enceph is brain and itis is inflammation. So this is inflammation of the brain. And this is usually, encephalitises are rare, but they do happen with certain viruses and bacterias. Usually the blood-brain barrier and the meninges protects us from all that, but every once in a while something happens and one of those little viruses or bacteria can get through there, and then it can cause all kinds of problems for the brain. Encephalomyelopathy. Encephalomyelopathy. This means, so we got opathy, this disease, myel. So we had that earlier. We know it means myelin or spinal cord. So it needs one of those, but let's keep looking at the rest of the word. Enceph, that means brain. So brain, spinal cord disease. So this is the disease of the brain and the spinal cord. The reason that I assumed that myel in this case meant spinal cord and not myelin is because it's attached to the word root for brain. So since it was next to brain, I knew that it meant spinal cord and not myelin. But if you couldn't figure that out, if on a multiple choice test next week, if you had the choices there, you would be able to figure it out. Trust me. I'm not going to make it so crazy and difficult that you can't understand it. Hemiplegia, because so plegia is paralysis and hemi means half. So this is paralysis of half of the body. So not like both of your legs or both of your arms, but half of you, like from a right and a left side. So like your right arm and your right leg, or your left arm and your left leg. Meningitis. What's meningitis? Somebody take a guess.
Inflammation of the meninges.
Inflammation of the meninges, inflammation of the covering of the brain and spinal cord. Meningitis, and you can get bacterial meningitis and you can get viral meningitis. Either one, no bueno. Meningocele. So we had meninges today. Who remembers what seal means? Somebody want to take a guess at this?
Hernia.
It's a hernia. So this is a herniation of the meninges. Very good. So I don't know if y'all have had this in with Dr. D yet, but you can have this is a type of, if you've ever heard of spina bifida before, whenever kids can be born with part of their vertebral column not formed all the way, and part of their meninges and their spinal cord can be herniating outside the body, and usually it's almost always in the lower back. There's different degrees of that. Sometimes if they find it before the baby's born, they can go in and do surgery and fix it in utero. And hopefully it'll heal up and form correctly. But usually they have to wait till after birth. And there's different degrees of spina bifida, but they're all a herniation of the spinal cord. Okay, this is just showing you the spinal cord and the different layers of the meninges. You don't have to know those layers, but if you do, you'll probably have to know them for A and P. They're the outer layer is the dura mater, and then the middle layer is the arachnoid layer, and then the inner layer is called the pia mater. Just for your information, though. Okay, let's make a few words. Meningomyelitis. So this is, we know it's inflammation of the meninges and the spinal cord. Meningomyocele. Okay, this is another word for spina bifida. So this is the meninges and the spinal cord are herniating outside of the body. Neural just refers to the nervous system or to a nerve. You probably could figure that out. Neuralgia, nerve pain. You've ever had, and that usually feels like like electricity, sharp shooting pain, numbness and tingling, things like that. Neurasthenia. Anybody remember what asthenia means? Asthenia means weakness, generalized weakness. So this means weakness associated with the nervous system. So all your neuro patients are going to have neurasthenia. They're going to have weakness that's associated with their brain or their spinal cord. Not from just pure lack of muscle strength, but it's going to be lack of communication with the brain and the spinal cord. Neurologist, you know, this is a person that studies the nervous system. This is the study of the nervous system. Neuropathy. What's a neuropathy? Oh, this is neuropathy. Who remembers what neuropathy is?
Discharge.
It is some kind of discharge from the nervous system, and you never want that. Poliomyelitis. This is poly means many or large. Myel is myelin or spinal cord, and itis is inflammation of. So poliomyelitis is a large inflammation of the spinal cord. Polyarthritis, you probably figured that. That's an old word. Just means arthritis in many places. And what's polymyalgia? Anybody take a guess?
A lot of muscle pain.
A lot of muscle pain. So it's not going to be a lot of muscle pain in one muscle. It's probably going to be many muscles. So it's going to be pain in many muscles. And when you have a neurological disorder, you can have neurological pain, or what we call neuropathic pain, that is pain that is not really coming from, there's nothing really causing the pain. Like there's nothing sharp pricking you, or there's nobody pinching you, or there's nothing sitting on top of you or hitting you or anything like that. But your body is, because of the the pathology, you feel these pains, kind of like you've heard of amputees will feel, they'll feel phantom pain. They might feel pain in their amputated limb, and even though they don't have a foot on that side anymore, sometimes they can still feel cramping pain in their foot, and that's a type of neuropathic pain. Well, a polymyalgia would be if any person with if any person had pain in many muscles. So if you've ever heard of fibromyalgia before, that's a that's a kind of a muscle / neurological / autoimmune disease. That's a polymyalgia. You have pain in many muscle spots all over your body. This is what a meningiomalocele or spina bifida kind of looks like. You can see that in the vertebrae that there's a defect and the column didn't close. So you can see the transverse processes, but there's no spinous process. And so the column didn't close. And so when the spinal cord and the meninges formed, they just pooched out of the spinal cord, and now there's nowhere to go except against the skin. And so if the baby is born, there'll actually be a big bump or in a big red spot on their lower back where that's pooching out, and they'll have to do surgery on that. And depending on the level, on how severe the cord is herniating out, some of these kids will have minor motor impairments and may walk with just a brace or like an assistive device for the rest of their life, but others will be in a wheelchair the rest of their life. So there's different degrees of this, but all these kids go through lots of years of therapy to try to maximize their motor performance. Okay. Yes.
Mr. Allen, for the RIAFE, I believe that word means suture or.
I thought it did. After I said that, I thought it meant suture. I didn't think it meant that. Thank you for saying that. So this would be a fixation or suture neuropathy of some kind of nerve, like a nerve or part of the brain. So even if you think suturing part of the brain, yeah, they have to do that when they do brain surgery. And if you've had a traumatic injury and things are moved around, they kind of have to put things right back where they go. They got to get rid of herniated blood and dead tissue, and they got to kind of put the skull back together. So they're suturing things back together, for lack of a better term. Okay, polyneuritis. So we got many, nerve, and itis. So this is inflammation of many nerves. Psychogenic, you've probably heard this word before. So psych means mind, genic means beginning. So this is just something that is beginning in the mind, or something that is in the mind. If somebody is a hypochondriac and they always think they're getting sick, or they always think there's something wrong with them, you could say, well, if they do have symptoms, maybe those symptoms are psychogenic. They're starting in their head and they're giving themselves the sickness, even though they're not really sick. They're giving themselves symptoms, rather. Psychologist is a person that studies the brain. Now, remember, a psychologist is not a medical doctor. A psychologist is a PhD that does more study of the brain and behavior and counseling. A psychiatrist is a medical doctor that is able to dispense medication for mental disorders. They may also do counseling, but their main job is for medical management. A psychiatrist. Psychologist is more of somebody that studies the brain. They study behavior. They come up with behavior plans. They help people with mental illnesses, and they may do some counseling too. But they do the heavy work with people. Psychology is the study of the brain. Psychopathy is a disease of the brain, of the mind. So you see the word psychopathy. So this could be somebody that has some kind of, now this doesn't mean this doesn't mean mental illness. This means something that is along the lines of making somebody, I guess for lack of better terms, a psychopath, making them they're very dangerous because of their beliefs or their delusions. Something in their mind is not right, and they're very dangerous to themselves or others. That's a true psychopathy. Quadriplegia. Who wants to take a shot at that?
Isn't it pain in like the 4 limbs, I think?
It's 4 limbs, but it's not pain.
Paralysis
Again,
of 4
Right.
limbs.
paralysis of all 4 limbs. That's right. Plegia is paralysis. Algia is pain. So quadriplegia is paralysis of all 4 limbs. And just let me throw this out there. Just because somebody might have paralysis of all 4 limbs, or paralysis of a limb, doesn't mean that it's completely limp and that there's no movement in it. You can have paralysis or hemiparesis and still have some movement in that limb. But if it's affected at all neurologically, then it's called paresis or plegia. But you can still have some strength in that limb, but it's just going to be not normal. Let's talk about diagnostic terms. Okay, cerebral angiography. So we know cerebral is brain. What's angi?
Blood vessel.
Vessels.
Remember?
Vessel.
Blood vessel. And graphy is a picture or an image. So this is a cerebral angiography. This is taking an image of the brain, the blood vessels in the brain. So they'll do that like usually with a CT scan. Or they may put some kind of dye, and sometimes they may put a dye in you. They'll call that contrast, and they'll do a CT or MRI, and they'll be able to see where the dye is flowing and map out the blood vessels in your brain. And that's how they'll be able to tell if there's a clot in your brain. They'll be able to see where the blockage is. Electroencephalogram. If you've ever seen kids or anybody that has epilepsy and they are getting a seizure test in the hospital, they have all kinds of electrodes hooked up all over their head. Well, that's an electroencephalogram, and it's electro, so electricity, enceph, brain, and gram, which is an image or a measurement. So this is a measurement of the electrical activity going on in the brain. So our brains are nothing but an electrical, our brains are just a electrical computer. And during a seizure is actually a surge of electrical activity in the brain. It's an abnormal surge of electrical activity. Think of it as a power surge at your house. So when somebody is having an electroencephalogram and they have a seizure, they're able to read all those abnormal electrical readings and determine what part of the brain it's coming from. And they're also able to determine how severe the seizures are and what different medications help in those different kind of seizures. Electroencephalograph is actually just the printout of the electroencephalogram. Let me say this slow. Electroencephalography, my goodness, is just the act of doing it, taking an electroencephalogram. A myelogram is a picture of the myelin or the spinal cord. In this case, it's probably going to be the whole spinal cord. There's not many there are some cases when you take pictures of just the myelin, but most of the time myelogram means picture of the spinal cord. Myelography, just taking the picture of the image of the spinal cord. Okay, Alzheimer's, and these are words not built for medical terms. Alzheimer's disease, we all know what that is. It's just a failure of the brain when you have plaques called prions, which form in the brain and take away your memories, your cognition, and eventually your motor function. A concussion is a mild brain injury that you don't necessarily have to lose consciousness with. You can keep consciousness, but it is a mild brain injury where you can have lingering visual problems, headaches, dizziness, light sensitivity, things like that. And it can last anywhere from a day or two up to a week or two. And yeah, that's all we'll say about that. Hydrocephalus. Anybody know what hydrocephalus is?
Water in the brain, around the brain.
This literally translates to water and brain, hydrocephalus. So we all have a certain amount of fluid in our brain called cerebrospinal fluid. Okay, and it circulates through our brain and through the ventricles in our brain, and it bathes our brain in nutrients, and this is not blood, this is more of a clear fluid that stays in the nervous system. Well, if you have hydrocephalus, that means that you have too much fluid in your head and that your brain is not draining off the fluid fast enough, and so there's a buildup of fluid. So if you often develop hydrocephalus after a brain injury, your brain might change structure or have a lot of swelling, and the brain can't get rid of all that swelling and that fluid. So you have to have an artificial shunt put in to drain the extra fluid from your brain while the brain is healing. Sometimes babies can be born with hydrocephalus, especially if they have cerebral palsy. And those usually, if they do have cerebral palsy, or if they have hydrocephalus, they almost always have cerebral palsy at the same time. They don't always go together, but sometimes they do. But a hydrocephalus baby will be born with literally a big head, and you might have seen babies with extra large heads before, and that's because they have extra fluid in their brain. It doesn't mean their brain is bigger, it just means they have extra cerebral spinal fluid in their head. So they're gonna, as they grow up and develop, like as they're infants and toddlers, they're going to have more trouble developing because their heads are going to be heavier. So they're going to take longer to develop head control. It'll take them longer to learn how to sit up because their head is just so heavy. So a lot of therapy with them works on head control and trunk control so they can keep up with their peers in their age group. Lumbar puncture is literally what it means. This is a spinal tap. When they go in between your vertebrae and they actually stick a long needle through your meninges into this, and remember, that's the covering around the brain and spinal cord. And then once you get through the meninges, you're around the spinal cord. Well, then that's where the cerebral spinal fluid is, and it flows all through the brain and spinal cord. So they can take some of that fluid out to determine if you have an infection like encephalitis or meningitis or something. Multiple sclerosis is we talked about this in the neuro and intro to PT. This is an autoimmune neuro disorder that forms plaques in the brain too. Kind of like, it forms plaques similar to Alzheimer's disease, but it's not like Alzheimer's disease. Alzheimer's disease happens more when you're older and it's very fast. Multiple sclerosis usually starts taking your motor problems, and then the cognitive problems starts happening later in the disease at the last parts of the disease, usually 20 to 25 years in. In Alzheimer's disease, it's a quick disease, and it's opposite. It's your memory and your brain function goes first, and then you lose your motor, and it's a very fast disease. Multiple sclerosis can be a long process, and it's a chronic, lifelong disease. There's many different types of it, but it usually is a chronic disease, where Alzheimer's is going to be very fast. And MS people, and if you do get MS, you can get it at different ages, but usually the average age is mid-20s to mid-30s is when you get diagnosed with MS. This is just just to give you see what Alzheimer's actually does to the brain. You can see in these pictures that the Alzheimer's brain is actually a little bit smaller. It actually does shrink a little bit. And you can't see it. If they cut open the brain, you can see it, but there's actually plaques that form on the inside of the brain, like, I guess for lack of a better term, like calcium plaques, or like plaques of minerals that form in the brain, and that's what cuts off all the nerve signals. This is what a lumbar puncture would look like. You can see where the needle is going between the vertebrae, and you can see how it goes through the meninges, and look how close it is to the spinal cord, to the ends of where it says cauda equina right there. That's the end of the spinal cord. So it's very close. So when they do a spinal puncture, they're doing lots of x-rays and images at the same time to make sure they don't nick your spinal cord, because if they do, then they've given you an injury at the same time. Okay, we know paraplegia. What's paraplegia? Anybody know?
Paralysis from the waist down.
Paralysis of the waist. Well, and it's not necessarily that most people do think it's waist down. It's from the trunk down. So anything that's T1 and below. Okay, so it doesn't. Paraplegia is paralysis. It can be paralysis of the trunk and the legs, but in paraplegia, the arms are always spared. So you always have full control of your arms. Parkinson's disease, that's a neurological disorder. You lose dopamine. We talked about what a seizure is. It's an abnormal electrical impulse in the brain. Stroke, we had that before. It's a cerebrovascular accident. That's when you have a blockage of blood in the brain from a clot or a plaque. Subarachnoid hemorrhage. That means, so remember in the meninges, you had the arachnoid layer. Well, a lot of times, if you get a brain injury, you can have bleeding inside the meningeal layer within those 3 layers. And a subarachnoid hemorrhage is a hemorrhage that happens under the arachnoid layer of the meninges. Transient ischemic attack, or TIA. This is what is known as a mini stroke. So you have a few symptoms of a stroke. They stay for up to 24 hours and then the symptoms go away. Can be a one-time thing, but it's usually a warning sign of a big major stroke coming. These are the differences so the A is hemiplegia. So this is just one arm and one leg on the side of the body. On B, they show paraplegia from the waist down, but it does mean from the trunk down, but the arms are always going to be spared. And quadriplegia is arms and legs. Now, most people that are quadriplegics are still going to have some motor function reserved in their upper extremities too. It'll be lacking. It won't be full motor function, but they still will have a little bit reserved. These are just, you can look at these. These are different types of strokes that can form from plaques, from clots and thrombosis to aneurysms. You can look at those on your own. This is just an example of bleeding in the brain of the subarachnoid hemorrhage. And you can see all that red, it's blood. Well, look what it's doing. It's not going inside and in between the gyri of the brain. It's pushing on the brain. And the brain does not like pressure. So when there's extra fluid in the head and it's pressing on the brain, either there's going to be major neurological symptoms or brain cells are going to start dying off really quick. So that's never good. This is what happens in a TIA. So you have a temporary blockage in the brain, and then you start to have some stroke symptoms. But then all of a sudden, usually within 12 to 24 hours, the clot breaks loose, dislodges, blood flow returns, and then all your symptoms disappear. So that's a mini stroke. Okay, let's just do a few abbreviations. So AD, Alzheimer's disease. Central nervous system. CSF is cerebrospinal fluid. CVA, cerebral vascular accident or stroke. EEG is electroencephalogram. LP, lumbar puncture. MS, multiple sclerosis. PD, Parkinson's disease. PNS is the opposite of CNS, so it's peripheral nervous system. And TIA is transient ischemic attack or mini stroke. So there's a lot of abbreviations from this chapter. And that's the end of that chapter. So let me stop that. So any questions from that chapter? Okay, a lot of neuro words, but a lot of them you probably have heard before. Okay, now the next one I'm going to be able to get through, it's on the endocrine system pretty quick. Do y'all need a 5-minute break or do y'all want to just keep going?
keep going.
That's what I thought. That's what I'd rather do too. Well, let's do it. Let me get out of the nervous system. Go to endocrine system. Okay, everybody still with me? Okay, thank you.
Yes.
Almost done. This is your last medical terminology. Just think of it, your last medical terminology lecture ever, and then you'll never have it again. Okay, endocrine system. What's the endocrine system? Who knows?
It's like the pancreas, the
Yeah,
hormone type stuff.
it's like hormones and like all of our glands, all the things that release hormones and special, like our pancreas releases insulin, all that's endocrine system. So the endocrine system are the different glands and parts of the body that release hormones and release other things that are like keys to turn on other systems in the body or to turn on other pathways. So like whenever we all start puberty, our sex hormones are released, and then we start our body starts developing, like our gonads release sex hormones, but that causes our whole body to develop. So we grow taller, our voices change, males and females, our voices mature. Males grow more muscles and things like that. So hormones do all kinds of things. They help us with our bone structure. They give us our, when we're growing at different stages of our life, that's when we hit our growth spurts, like when we're toddlers, and then we're growing really fast, and then we may slow down, and then around 3rd or 4th grade, maybe speed up again, and then slow down again until puberty. You get the idea. You knew all that. Okay, so here's just a few of these are the main glands in the body. So let's start up at the top. Your master gland, which is kind of like, and it's in the brain, it's a pituitary gland. It's very small. It's about the size of a pea. The pituitary gland is like the master gland of the body. And you can think it's the master gland of the body. It controls all the other glands of the body. Well, it's in the brain, so that makes sense. So the brain is in control of everything. Well, the pituitary gland is in control of all the other endocrine glands. Then you've got the thyroid gland, which helps with metabolism. You've got the thymus. You've got, on top of the kidneys, you've got the adrenal glands, and the adrenal glands are what produces adrenaline or norepinephrine, which helps you which is helpful in the flight or flight response. So if you're in a situation and you've got to do something really quick and you've got to act really fast and take action really fast, then you're using your adrenaline from your adrenal glands. Or if something happens and you're not going to fight the situation, but you're going to run away from it. Like if you were a caveman and you're running away from a wild boar or something, or a mastodon, then you're using your adrenal system to give you extra energy to run away real quick. You've got to get away in this situation. And then we know what the ovaries and the testes do. I don't think I have to go through that. If we do, then we need to talk another time. You can see a bigger picture of the pituitary gland. It's made up of an anterior and a posterior part. And it's kind of in the front of the brain, and it's on the undersurface, kind of like right above our sinuses, right in front of the brainstem. And then in the back of the brain, you've got one more called the pineal gland. It's pretty important too, but not near as important as the pituitary gland. Not near as important as that. And you can just see how this is showing that the pituitary gland is the master gland. And it basically, when the pituitary, when there's time in life for a hormone to be released, the pituitary gland first releases its hormone, and then it flows through the bloodstream and is picked up by the appropriate organ that the pituitary gland meant to turn on in order for that hormone to be released. So just an example, if if you're a new mother and you just gave birth, well, the female body is the brain, the pituitary gland is going to tell the mammary glands to produce milk. Okay, so pituitary gland is gonna release its hormone and it's gonna go through all the bloodstream through the whole body, but that hormone is only gonna turn on the mammary glands. It's only gonna turn on prolactin releasing hormone in the mammary glands. So even though that the pituitary gland released its hormone and it's going through the whole bloodstream, it's only gonna be released by the mammary glands, and then the woman will produce milk for her infant. When it's time for us to go through puberty, our pituitary gland knows that, and it sends certain hormones to certain systems of the body. So certain systems start growing while others do nothing. That's what happens. That's why the hormones are very, very, very specific. Think of them as like a computer code. They do very specific things. Pancreas is another one, part of the endocrine system. Releases insulin, so we can take in glucose into our cells and live. We won't worry about these. There's a lot of pictures. This is just a front and a back view of the thyroid gland. And you can live without use. A lot of times they go in and you might have to have part of your thyroid removed due to cancer or hyperparathyroidism or hypo. Sometimes that happens, or sometimes people can have cancer around the thyroid. Okay, I've already said all this. Functions of the endocrine system: regulates body activity, secretes hormones, influences growth, development, and metabolism. Blah, blah, blah. So I don't think I mentioned metabolism, but yeah, like if you've ever heard people say, I have a fast metabolism, I can eat all day and I barely gain anything, or I have a slow metabolism, I barely eat a bite of anything and I gain 10 pounds. Where your thyroid gland is mostly in charge of your metabolism. So if you have a fast metabolism, that means you are a person that is burning a lot of calories, and your body burns a lot of calories. You're either up and moving a lot and you're really active, or your body just burns calories faster naturally. That's just all that means. Okay, let's start with some words. Adrenal stands for adrenal gland, which is on top of the kidneys. Crine means to secrete, and that's part of the word endocrine. So crine means to secrete, and that's going to be inside the body. Dips means thirst. Okay. Glyce means sugar. Think of like glucose, or if you've ever heard of glycemic index pertaining to diabetes. Thyme means thymus gland, and thyroid just means thyroid gland. Those are pretty self-explanatory. Okay. Ism just means a state of, not really a medical word. Acromegaly. We've had this before. What does acromegaly mean? Anybody remember? What's acro? Enlargement of an extremity. So you can have, when you're growing, you can have one or two extremities that grow abnormally big as part of an endocrine disorder. So maybe your arm, you might have a leg length discrepancy where one leg is longer than the other, or one arm is shorter than the other, or something like that. Adenoma. This is a tumor of the adrenal gland. Okay, adenomegaly. So a lot of times there are problems with the adrenal gland, and this means enlargement of the adrenal gland. So or a gland. So this can just be an enlargement of the adrenal glands or another gland. Adenosis. This just means an opening up a gland or the adrenal gland. Adrenalectomy. What's that?
Removing the adrenal gland.
removal of the whole or part of the adrenal gland. It's excision of, so removal of part or whole of the adrenal gland. And you've got two, so you can live with one. Adrenalitis. Print this up. That's pretty easy. What's that mean?
Inflammation of the
Inflammation and adrenal.
Inflammation of the adrenal gland. Couldn't get that past y'all. Adrenalopathy. What's opathy? Disease of the adrenal gland. You're starting to pick up that there's a lot of things that can go wrong with your adrenal glands. Endocrine just means the endocrine system. So we know crine means secrete. Endo, what's endos mean? This is easy.
within.
Then
Within or inside. So this is just something in the endocrine system secretes things only inside of the body. So it secretes its hormones inside the body, not outside. Endocrinologist is just a doctor that studies the endocrine system. This is just the study of the endocrine system. What's glycemia?
Blood sugar.
This is blood sugar. Blood sugar, very good. Glyce means sugar. Emia means blood. Glycemia means blood sugar. Hyperglycemia. This is when you have too much glucose in your blood. And you usually, and this is, diabetics have to worry about hyperglycemia and hypoglycemia. If you have hyperglycemia, that can mean a couple different things. You might not have enough insulin in your blood, and so you need an insulin injection because you've got too much glucose in your blood. That means the cells can't take in the glucose and are starving, so they can't make energy. So they need their glucose. I mean, they need their insulin and to get their glucose inside the cells. Hyperthyroidism is when either the thyroid will enlarge or the person's metabolism will abnormally increase. So these people may have an enlarged thyroid and their metabolism increases. So they're burning calories like crazy. They might even have to take in more than 2,000 calories a day just to maintain their weight. Hypoglycemia is another thing that happens to diabetics. This is the opposite of hyperglycemia. This is when you have not enough glucose in your bloodstream. So this is when you're working with people and they get sleepy and dizzy. This is when you give people like juice, like orange juice, or you give them, like, people will keep like candy with them if their blood sugar gets too low. That's what happens. They don't have enough glucose in their blood. Hypothyroidism is when your thyroid slows down and your metabolism slows down, and then you start gaining weight. You can't burn calories very good. Polydipsia. Anybody want to take a gander at that? What did dipsia or dip mean? Dips.
is that ice cream from Dippin' Dots?
Increase
Not
a
Dippin'
lot
Dots.
of being really thirsty.
This means
Yeah,
this means
thirsty.
many thirst. So this means being very thirsty. So a lot of times, if somebody is going through hyperglycemia or hypoglycemia, they're going to be very, very thirsty. Now, this is not like just after you've worked out and you're a little thirsty. This is like their mouth is so dry, all they can do is thinking about, I've got to get water right now. Like their mouth is just like so dry. They've got to get water. They're so thirsty, they're about to pass out. That's how they feel. That's true polydipsia. What's polyuria?
A lot of urine.
This is a lot of urine. So sometimes people that have uncontrolled diabetes will urinate a lot. And that can be a sign. That can be sometimes one of the first signs that you have diabetes is lots of urination. Excessive urination that is just not normal. A thymectomy is just removal of the thymus. Thymic just pertains to the thymus. Thymoma, tumor of the thymus. Thyroidectomy is removal of part of or all of the thyroid. Thyroiditis is inflammation of the thyroid. Very self-explanatory. Addison's disease. Anybody know what this is?
Where you get unusually dark.
Yeah, it's kind of a disease. It's a disease of the, it's an endocrine disease, but your skin does get a little bit dark. And a lot of times I think that goes along with goiter too, if I'm not thinking of Graves' disease. Is Graves' disease on here? I get Addison's and Graves mixed up. You don't have to know the difference between them, but you just have to know they're endocrine diseases. Diabetes is DM. That's diabetes mellitus is a problem of the pancreas when you don't produce enough or your own insulin. And remember, there's type 1 diabetes that's usually called juvenile diabetes. This is what you're born. You're born with it, or you develop it slowly after birth. And diabetes mellitus type 2, diabetes type 2 is what you develop from obesity or being sedentary or a poor diet and poor lifestyle. So type 1, you're born with, you develop, can't help it. Type 2, you developed it because of your lifestyle. Fasting blood sugar, if you've ever had to do blood work in the morning for any reason, and they tell you you have to fast, so don't eat or don't eat anything the morning you get your blood work done. That's called a fasting. They're testing your fasting blood sugar. They're trying to see how well your pancreas is acting, and how much glucose it's releasing, even though you're not eating anything. And there's a certain range that is supposed to be normal, even more fasting. And so that's why they do that. If you eat and then go get your blood tested, your blood sugar will be all over the place, and it should be high. And then it won't be your true baseline. So they do a fasting blood sugar to see what you're like at your baseline without any influence of food or drink or anything like that. Goiter is just an enlargement of the thyroid gland. And that's when somebody gets like a really large, like their neck might swell up really big on one side or in the middle. It's usually more centralized. I think I have a picture of that next. This is just a little bit on diabetes. I'll let you read through those. This is a picture of a goiter. And if you see how she's got a little bit of that darkening skin too, a lot of times these diseases go along together, but you can tell her neck, I don't know if you can see it in my picture, but her neck is just, it's swollen in the front and on the side. So this is what's known as a goiter. I have seen them before, or I've never seen one in real life, because I think they tend to take care of these when they're really early, but I have seen cases of like, I guess maybe like the people that were like really older back in the old days that didn't get things taken care of. They just let things go. And they were just like on the side of their neck, and they were just like these huge things growing off of them, and they looked terrible. That was maybe back before they knew what to do, but now I think they catch it pretty quickly, and they can also take care of with medication too. We only have 2 abbreviations for endocrine. So it's diabetes mellitus and fasting blood sugar. And DM can stand for diabetes mellitus 1 or 2. And that's it. So I hit y'all 2 chapters today. A lot of info, but any questions on anything before we talk about test? Okay. Pretty self-explanatory, just like the other chapters. Okay, so next week will be final, and it's going to be over the whole, all the chapters we went over so far, okay? My test is going to be exactly the same format as the first 2 tests. It'll all be multiple choice. There'll be root words, prefixes, suffixes, and then mostly words put together that you have to get the meaning of, okay? Or it might give you the meaning of the word and you have to pick out the word. Now, most of these things, if you've probably picked up on the pattern so far taking my test, if you are looking at at a word or a meaning of a word, if you don't know it, if you just don't know it from memory, a lot of times you can go by process of elimination and start crossing some out, and you can pick it out that way. So if you get to a word and it's got many parts, don't just try to take a guess of it. And you probably have figured this out already. Break the word up into its parts, translate it literally, and then start looking at the choices and see what fits. that's how you can get, that's how you'll get through the final. And my final is not meant to trick anybody. I'm not going to put answer choices on there that are so close that that they could both be right. I'm going to make it very self-explanatory. It's probably going to be about 100 questions. You'll have about a minute per question. Even though you probably won't need that, I'll give you about a minute per question. You'll finish way sooner than that, I promise. It'll be next Tuesday. It'll be open all day. So if you want to start earlier than 10, 11, you can do that. And it'll be open all day till midnight. And if you want to go over any of your former tests, we can do that. Just let me know, and we can find a time, like maybe after lab on Wednesday or like tomorrow, or we can Zoom sometime individually sometime later this week if y'all want to. Or if there's a group of y'all that want to get together and ask me some questions, we can do that too over Zoom. Just let me know and we can do that. I'm going to be at campus on tomorrow because y'all have an open lab time available tomorrow afternoon after class with Miss King. And then on Friday afternoon, or Friday morning and Friday afternoon, there's some groups that are open. So if y'all come to open lab, I'll be there both of those days. And I can definitely answer some of your questions then too. So I'll be there for then. So I'm going to make this announcement in Intro to PT. I'll be there in the morning for lab, for y'all's A&P lab. The majority of your lab tomorrow is going to be with me for Intro to PT. We're going to go over positioning and draping. That's the part of your schedule that said that skill comp video was due this week. There's no way that that's going to get done. So just ignore that. We're going to go over most of it tomorrow. Miss King doesn't have lots for you to do for palpations tomorrow for bony prominences. So most of the lab time, y'all's lab time will be with me tomorrow. And then what we don't finish, we'll finish either the next week in her lab or the following week. So we have a couple of weeks we're going to break this up, but we should be able to get through a lot of it tomorrow. But we'll go online on YouTube. And it's on the Intro to PT. The links are there, but there's links on YouTube for positioning and draping. There's 3 for positioning and 3 or 4 for draping. So look at those, and those should be with, I think it's me and Dr. K are the patient and therapist, or me and Dr. D, one or the other. So it's us acting it out. So any major questions before I let you go? Let me stop
You said
recording.
that we had paper